Hi everyone, welcome back to my channel. I am Shahan and today in this video I will discuss about Argyll Robertson Pupil. This is a very hot topic and it comes several times in Neetpg and also in FMGE examination. So if you are preparing for any of these examinations like FMGE or Neetpg or next examination, you can watch this video. You will have a great knowledge from this video. So what is Argyll Robertson Pupil? You can see this picture first. On the left side, you can see the people do not react with light. So whenever there is light given on the people, it will not react. Number one characteristics. And number two characteristics on the right side, the people react briskly to accommodation. So whenever a near object is put, the people will react. Let me explain it with the help of the definition first. You can see Argyll Robertson Pupil definition. Argyll Robertson Pupil describes as the physical examination finding of bilaterally small people. So what will be the size of the people? It will be very small and that do not constrict when exposed to bright light. So whenever you put bright light on the people, it will not constrict. Generally normal people, what happen, whenever you focus bright light on the people, it will constrict down. It will not allow so much bright light to enter. So it will constrict down. But in case of Argyll Robertson people, these are bilateral small people and they do not constrict. Very important. But do constrict when focused on a nearby object. But these people will constrict when there is any near object. So whenever some near object comes to it, like whenever you put a finger and you allow the finger to come closer to the eye, then it will constrict. So the near accommodation reflex, the near reflex is working here, or the accommodation reflex is working here, but the light reflex do not. This is very important. So Argyll Robertson Pupil describes the physical exam of bilaterally small people. So the people is very small, they do not constrict whenever bright light is given, but it will work. It will do constriction when focused on a nearby object. You can remember these two characteristics are very important for Argyll Robertson Pupil. You can see with the help of picture. Now you look at this picture. On the above picture, you can see that the peoples do not constrict when exposed to bright light. Number one, the people do not constrict when exposed to bright light. You can see torch is given, but it is not constricting. The people are very small and they should constrict, but they are not constricting. In the second picture, you can see on the below picture, people do constrict on near objects. So whenever a finger is close to the eye and you ask the patient to look at the close object, your finger, then you can see the pupil has constricted. It has become smaller. So this kind of behavior of the pupil, that in case of the light reflex, it is not responding, it is not constricting, but in case of accommodation reflex, in case of nearby object reflex, you can find out that the constriction is taking place. Whenever this contrast phenomena is occurring in any patient, you can understand this is Argyll Robertson Pupil. It is very important for your Neetpg examination and also FMGE examination. Always they give you a history of a patient who in whom you have checked the light reflex and you cannot find anything, but when you put the accommodation reflex, you can find. You can see this picture, the above picture, you can see light reflex is given, a torch is put and the patient is asked to see the light, but there is no change of the pupil. The pupil should constrict itself because it will not allow, generally in normal people, it will not allow lot amount of light to come inside. But in case of the second picture, you can see the downward one, that whenever a finger is put close to the eye, you can see the pupil will constrict. So this is the near reflex, or you can say accommodation reflex. Now you see a case is given to you a man presented with difficulty walking and urinary incontinence. On examination, his pupils were non-reactive to the bright light. So whenever a bright light is focused, it is not reacting properly, but it constricts whenever it is focused on near object. So what is your diagnosis? Hope now you can answer this question. Write down in the comment section below, and if you want similar topics or other topics to make video on, you can write down in the comment section below. Thank you so much for watching this video. If you like this video, make a thumbs up and please subscribe our channel. Have a nice day. Bye bye.